And so it says here on this CBS News webpage article, Money Watch, Managing Your Money, what costs does Medicare not cover in 2025? And I think that this is a great read. It's quick, and I'll share it with you guys. Reaching Medicare age is a big milestone, one that can feel like a payoff after years of working, paying taxes, and worrying about covering the cost of health insurance. But while Medicare is a powerful tool for managing healthcare expenses, many retirees quickly discover it's not the all-inclusive safety net they expected. In fact, relying on Medicare alone can sometimes leave you exposed to major unexpected costs. And as a result, simply enrolling in Medicare typically isn't enough to fully protect your health or your wallet during retirement. And while it's true that Medicare helps cover a significant portion of your medical needs as a senior, the reality is that it doesn't cover all services, treatments, or supplies. That means even a solid retirement savings cushion can erode faster than you think if you don't have a plan in place for the uncovered gaps. And I don't know how many of you out there are nearing retirement age, nearing the age in which you would need to apply for Medicare, and preparing for retirement and hoping that Medicare will be enough to cover your healthcare expenses and not erode your savings, your retirement savings cushion faster than you have a plan for, and are avid golfers, because ironically, Chris Pope and City Journal ask, should Medicare cover golf fees? Poorly structured payments to insurers have yielded a massively expensive boondoggle, funding perks like trips to the links, ski passes, and pet food. Oh, wow. There's a lot of talk about Medicare in the news right now, and the lawsuit currently with the Department of Justice. I would imagine that Medicare being used to cover greens fees would probably fall into that same category.
The DOJ has launched an investigation into Unitedhealth's Medicare billing practices. This is according to the Wall Street Journal report. It's a civil fraud investigation. It's focused on the company's practices for recording diagnoses that trigger some extra payments to Medicare Advantage plans.
The Justice Department is going after Unitedhealth in a massive fraud investigation. Billions of dollars could be on the line. Here's what you need to know.
Back to Doe just for a second. Earlier, the subcommittee headed by Chairman Marcia Taylor Greene, her and her staff discovered $2.7 trillion in improper payments to Medicare, Medicaid, overseas, to people who should not have gotten it. Some of this room might have missed that press conference. Can you elaborate on what the president is thinking at this point?
You know this, all these things inside out, Doctor, and there have been myriad complaints about some of these Medicare Advantage plans. Reading about how this works, it could certainly be rife for abuse. I'm wondering whether you have anecdotal evidence of things like this occurring. Do you understand what they're saying? That you get a lump sum from Medicare for these Advantage plans. If you find some additional diagnoses, you're able to go back to Medicare and say you owe us more money.
The Justice Department has launched a fraud investigation into Unitedhealth Group's Medicare billing practices. This is according to the Wall Street Journal. Regulators are looking into whether the company inflated patient diagnosis to increase federal payments under Medicare Advantage plans.
And in this investigation, they seem to have identified people that said there was pressure from UnitedHealthcare to push some of these obscure diagnoses that people didn't really have, just to get the additional payments from Medicare. Do you know whether that goes on?
Well, look, this relates to the story that ran in December in the Wall Street Journal, it looks like, where there was a story that showed that Medicare systematically upcoded the sickness scores of patients as they transitioned from fee-for-service Medicare into Medicare Advantage. So they showed a 55% increase in the sickness scores of patients as they transitioned from fee-for-service Medicare into Medicare Advantage versus an industry average of about 30% for patients who transitioned into Medicare Advantage plans. Versus if you look at patients who just remained in fee-for-service Medicare, their sickness scores went up 7% year over year. So it looked like UnitedHealthcare was an outlier in terms of how they were aggressively upcoding patients as they transitioned into Medicare. Now, it is the case that Medicare Advantage plans do a better job on the whole of identifying comorbidities and do a better job of systematically coding for them than patients who remain in fee-for-service Medicare, because there's a financial advantage to do that, and there's also a financial incentive to try to more aggressively manage the overall health of that population. But Unitedhealth being an outlier in this regard attracted a lot of attention when that article hit.
So what's raising the red flags? Well, Unitedhealth allegedly trained doctors to document conditions that would generate more revenue, even if patients didn't actually have those illnesses. The probe is also examining whether the company's software suggested medical conditions that would boost Medicare's reimbursements. This isn't the first time Unitedhealth has faced scrutiny. The company is already under antitrust investigations and recently fought off a lawsuit trying to block its $3.3 billion acquisition of home health company Amedisys. If the DOJ finds wrongdoings, this could lead to major penalties, regulatory crackdowns, and possibly one of the biggest healthcare fraud cases in years.
Well, again, that's another example. There's a very long list of the fraud, waste, and abuse that DOJ is identifying on a daily basis. Elon Musk also talked about yesterday about Social Security payments that are going out the door for people who are no longer with us. Unfortunately, I would say that is certainly fraud. There's also a lot of contracts they've identified that, just as a hypothetical example, are $1 million, but only 500,000 went out the door. So where's the rest of that cash? And so that's the thing. Those are the things that DOJ is working on every single day. And I would just remind everybody in this room, this is what President Trump campaigned on doing. He's delivering on a promise that
I will say that this is a industry-wide practice. A lot of health insurers, Medicare Advantage plans, adopt different tools to try to incentivize and prompt physicians to code for things like hypertension and obesity, things that might not be noticed in the chart and not necessarily billed for. So if the DOJ goes after this with respect to UnitedHealthcare, I think it's going to send a chill across the entire industry. A lot of different Medicare Advantage plans and healthcare services providers are going to have to relook at their practices if, in fact, this becomes something that is a target of the investigation.
And UnitedHealthcare says, hey, preventing chronic diseases early is what we want to do.
Carla Jerviston gave a whopping $14.6 million to support Elizabeth Warren for the Senate. This is her, and she is a physician. Not only did she attend Stanford, her father was a professor there for over 50 years. And to honor her father, she helped fund the construction of the new Stanford Medical Center. You know who else has ties to Stanford? Pfizer. Back in 2010, they gave a grant to Stanford saying that there's no strings attached. Put your hand up if you actually think that's true. I'm sure nobody. And the grant was $3 million to back new curriculum. But wait, there's more. Pfizer funded an independent educational grant program through, surprise, Stanford. How do all of these dots connect? Well, honestly, that's kind of difficult. As I was doing research, it is very clear that a lot has been hidden here. But this article may give us a hint. Looks like Stanford professors have been found to receive money right from big pharma companies like Eli Lilly. Why does this all matter? Funny enough, I think Dr. Casey Means has already given us the answer. She went to Stanford and was top of her class. She talks about how there was never a class about nutrition, about exercise. She simply learned a diagnosis and a pill to solve it. Because the minute that we find out that we can heal ourselves with food, think about whose bottom line is going to hurt real bad. So to summarize, in addition to all of the money that Elizabeth Warren receives through the healthcare industry, she also has some funny ties to Carla here. Do you think she's actually really concerned about him bringing back polio? Or is he just going to hurt her donors' bottom line?
So they've got a ready-made sort of an answer to why they might find more things than usual. But then again, you've got some individual cases where someone was told there's something, I don't even know what this is, doctor, hyperaldosteronism, which is a secondary hormonal condition. You don't even need a blood test. So someone could go in and say, you've got this. You could bill Medicare for it, whether they have it or not. It just seems rife for abuse. But then again, the company probably has an answer for that.
Well, look, a lot of this relates to the Byzantine way people are forced to bill Medicare, and I think the solution for this is to move towards more capitated models of reimbursement where provider systems are given lump sums of money to take care of an overall population rather than billing for individual patients or getting these sort of upcharges or, additional revenue if they can diagnose patients with more illnesses. And so we used to worked at Medicare and Medicaid, we used to describe working there as a game of whack-a-mole, trying to keep up with what the healthcare industry did to try to, frankly, game the different billing systems that Medicare rolled out. And so I think trying to pay for the overall health of populations rather than individual patients and looking at these kinds of sickness scores that allow Medicare Advantage plans to get additional revenue, ultimately that's where the solution is going to lie, different kinds of mechanisms. But as I said, this is an industry-wide practice. UnitedHealthcare does look like an outlier based on the Wall Street Journal's reporting. You never want to be an outlier in these regards, but there's an incentive in the program to get patients diagnosed and manage the healthcare of patients more aggressively, and they're paid for doing that.
The Justice Department is reportedly investigating Unitedhealth Group's billing practices. That's the same company whose CEO was shot and killed here in New York City. According to the Wall Street Journal, the new civil probe is looking into allegations the company profited off false diagnoses. Medicare Advantage, run by private insurers, covers nearly half of the 68 million people enrolled in Medicare. These companies receive payments per patient, but can get more for those with complex health conditions. Last summer, the Journal reported UnitedHealth added diagnoses to patients' records for conditions they weren't treated for, triggering an extra $8.7 billion in payouts to insurers. News of a DOJ investigation sent United stocks plunging 7% Friday, a $30 billion loss in market value. The company called the report of fraud, quote, misinformation, and saying they are not aware of the launch of any new activity by the DOJ.
And so, health insurers have responded to that by implementing these systems that prompt physicians to look for these diagnoses, code for them, and then bill for them.
Doctor, just real quick, obviously a lot of people are going to relate this in their mind to the murder by Mangione and what that's all about. How do you think about that in terms of this investigation as it relates to that? And I don't even know where to go with this.
Yeah, I don't think about it. I think that was a violent crime and has no bearing on this by someone who seems to be deranged, quite frankly. This is completely separate. These are billing practices that result from the policies that Medicare has put into place. And that's not to absolve UnitedHealthcare of potentially gaming these systems, but we need to look at the way, we ultimately ask people to bill Medicare.
I look at it a different way. I look at it, you've got something for everyone. You've got potentially a predatory for-profit company gaming the system at this fat, bloated government agency that wouldn't know if it was getting stolen from if its life depended on this bloated Medicare system.
President Trump has been very clear with me. He said it publicly. He wants to love and cherish, I'm quoting him, Medicare, Medicaid, these programs. We are focused on saving Medicaid. That's what we've got to do. That's the existential threat, that you spend it into the ground and we don't have the resources to take care of our most vulnerable. I'm sitting right now in the Humphreys building, which is the Health and Human Services building. Bobby Kennedy and I basically live here now. If you walk in the building, there's a quote from Hubert Humphrey. It says it's a moral obligation of government to take care of people who are in the dawn of life, children, people in the twilight of life, mature seniors, and people who are in the shadows, those with disabilities. To do that, you have got to make the system work better. And Democrats should be cheering us on because we're going after problems that have plagued the system that people have not dealt with for the last 4 years. I'll give you a couple examples, Bill, simple ones. $1 billion spent, Medicare money, taxpayer money that should have gone to impoverished children and seniors struggling with the illnesses that you get when you get older. And this $1 billion went because people were registered in multiple states on Medicaid at once. So you're paying a lot of states, even though they're not living in those states anymore. We've got $200 million spent on housekeeping services. Is that part of the charge of Medicaid? $10 million spent on student loans from Medicaid. That could go to saving people who have sickle cell anemia with gene therapy. That's remarkably effective.
What do you think at this point the fraud and waste at Medicare and Medicaid is, doctor? Is it 30%? I mean, this is why we have a problem.
Yeah, I don't think we can put an estimate on that. I'm sure people have tried to do it. I haven't seen them. But look, like I said, if you're going to be billing Medicare for individual diagnoses like this, and you're going to get incentives for trying to turn over different illnesses that patients may have so you can upcode for the care of a population of patients, people are going to implement systems to try to turn over those diagnoses. And sometimes they're going to go too far. And maybe that's what happened in this case. UnitedHealthcare was doing it more systematically.
But did Medicare have any idea?
We don't know.
Is there anyone minding the store?
What happens if it comes to your desk, has the tax cuts, but also cuts to Medicaid? Would you veto that?
Well, we're not doing that.
Would you veto that?
I would if they were cutting it, but they're not cutting it. They're looking at fraud, waste, and abuse. And nobody minds that if illegal immigrants are in the mix, if people that aren't supposed to be there, people that are non-citizens are in the mix. Nobody minds that. Waste, fraud, and abuse. But we're not cutting Medicaid, we're not cutting Medicare, and we're not cutting Social Security.
Of the taxpayers.
It's very retrospective. Yeah, look, it's very retrospective, and that's why I said it felt like a game of whack-a-mole when I worked there, where you were always trying to play catch-up to what the systems were doing to try to, frankly, find ways to legally game the billing system. We can move towards different reimbursement models. I think that could help resolve some of this, where we just pay lump sums for populations.
And then you don't want to turn anyone down, because then you're back to your question.
Right. The Justice Department says some of the country's biggest Medicare insurers paid kickbacks to push more plans and grow their market share, while also avoiding individuals with disabilities or other health issues that may have created a cost burden for the insurance companies.
Breaking news, the Department of Justice has just filed a complaint accusing 3 of the largest health insurers of paying illegal kickbacks to major insurance brokers in exchange for steering patients into insurers' Medicare Advantage plans. The DOJ accusing CVS's Aetna, Elevance Health, and Humana of paying kickbacks to brokers. eHealth, GoHealth, and SelectQuote. The Justice Department said that rather than acting in an unbiased manner and in the best interest of patients, the brokers directed Medicare beneficiaries to plans offered by insurers that paid them the most in kickbacks. And of course, this only underscores that the healthcare industry clearly needs a transformation. Listen to this.
You've got this huge technological shift that we all think about all the time around AI. What that's leading to is a fundamentally different kind of an opportunity. We will obviously have founders start new businesses that are innovative, but the big opportunity is how do you transform existing businesses? So in that context, a whole new set of companies need to be created that enable that transformation of these industries.
So that was General Catalyst CEO Hemant Taneja on the Claimant Countdown Monday, highlighting how new companies are utilizing the power of AI to revolutionize existing sectors. One of the better examples of this company that has successfully transformed a historically problem-plagued sector is Waystar. The healthcare payments company was the biggest healthcare and software IPO of last year. Raised $1 billion, and the stock has soared 90+% since it started trading on June 7th.
The allegations are part of a lawsuit filed against Aetna, Elevance Health, and Humana. On Thursday, the Justice Department said the 3 insurers paid hundreds of millions of dollars to brokers to boost enrollment in their Medicare Advantage plans. In statements to multiple news outlets, Aetna says they are reviewing the complaint but don't agree with the allegations, which they plan to defend vigorously. A Humana spokesperson told Newsweek something similar, saying their priority is providing outstanding healthcare coverage and continuing to support healthcare innovation, better health outcomes, and deeper patient engagement. Elevance says they're confident they complied with federal law and they will continue to do so moving forward. 3 insurance brokers are also listed as defendants in the complaint. They're eHealth, their affiliate GoHealth, and SelectQuote. According to court documents, the kickbacks fall between 2016 and 2021, which the DOJ says violates the False Claims Act. People who qualify for the Medicare Advantage program are known as beneficiaries. They have the choice of choosing a private insurance company. Typically, individuals work with an insurance broker, which acts like a middleman, to help them find a plan based on their health needs. The DOJ says brokers steered people toward the insurer paying the biggest kickbacks, but not to a plan that best fit an individual's needs. Federal prosecutors say people with disabilities were driven away because they were considered to be less profitable to the health insurance companies.
And so I would say that talking about Medicare and, more importantly, free Medicare help and Chapter, our partner Chapter, offering free consultations that not only are very helpful and beneficial, simplifying a very confusing and complex process, have already proven to be successful with the comments that you guys are leaving on these videos. Roger Stubbs, he said, or better yet asked, how is Chapter funded? And as I've told you guys before, I can't wait to read all your comments. With that, I hope to bring you guys answers to the questions that you have. This one in particular, with many more to follow. Business Week just posted this just a few days ago. A MAGA-backed AI healthcare unicorn attracts an unlikely coalition. Startup Chapter, our partner Chapter here, co-founded by Vivek Ramaswamy and previously backed by Peter Thiel and JD Vance, just closed a VC round valuing it at $1.5 billion. That's a venture capitalist round valuation, $1.5 billion. Oh man, but wait, because there's more. And there's so much more you're not going to want to miss. So stay tuned, folks.
The stock is moving even higher right now on a strong earnings report where the company beat on revenue and raised its full-year guidance. Joining us now in a Fox Business exclusive, Waystar CEO Matt Hawkins. Matt, very impressive, but even more impressive is one part of what you are transforming, and that is figuring out how to deal with patient denial claims, which have been ridiculously high. The insurance companies, it's almost like they're rubber stamping, deny the claims. And that's horrible for doctors and patients in many cases. How is what you're doing at Waystar fixing that?
Well, good afternoon, Liz. It's an exciting time to be doing what we're doing. Thank you for recognizing our share price performance and the importance of our mission. We have a strong business model, and we've delivered 4 consecutive quarters of double-digit revenue growth and adjusted EBITDA margins as a public company, a rule of 50 type business. And really, it's because of the strength of our business model, the importance of our mission to address this really cumbersome manual work that goes into providers as they interact with payers. Oftentimes they get those claims denied. We're helping bring software to bear on that. We're bringing automation to bear on that. And it's a statistical fact that there's nearly $500 billion of waste that occurs in the United States every year. A lot of that can be bucketed in the category that you highlighted, denied claims.
Hey, it's Dr. Potter. Can you just tell me your name one more time? I'm sorry, you won't give me your name? I don't understand the relationship. I'm just asking for your name so that I know what doctor I'm speaking with. If we're doing a peer-to-peer, I just want to know who you are. So United won't let you give your name out for security reasons. Can you tell me what specialty you are? Did you do breast reconstruction? You did not do breast reconstruction. Okay, is it her plan that's not allowing her to have this, or United? Does she have a plan exclusion? Can you send me that evaluation? Like, can I see their reasoning and thought process when they've reviewed the literature to see what they reviewed? I mean, you understand this is this patient's one chance to have sensation preserved. And I do think that it's very reasonable to do this as a fellowship trained microsurgeon. I think it's very reasonable to dissect out the fourth intercostal nerve and to graft that to the dermatosensory elements on the nipple to try to give her this chance. Yeah, I would just love to see where United has gone through that data. I mean, I'm a physician, I'm a doctor, and I feel like I'm making a medical decision for my patient. It seems like United is making a medical determination about this. And I don't exactly know how that works, right? It seems like they're practicing medicine. I just want to read it like a paper, right? And see what the references are so I can understand. Can you email it to me? You're not allowed to email it to me? It's an internal resource. I mean, there's data from 2023 and 2024 showing that this is effective. Yeah, I really would love to read that and see what United is using as the data to support that. And This is her only chance, right? Okay. Yeah, I'll do an internal appeal. Yeah, and I appreciate your time, and I'm so sorry that y'all aren't allowed to give out your names as a fellow physician. Like, I would love to be able to talk to you like you were a peer, but it's crazy. Yeah. Well, best of luck to you, and I appreciate we will appeal. Thanks. Bye.
And insurance denied and delayed, denied and delayed, denied and delayed. They denied a $3,000 not medically necessary stent, and instead, just St. Luke's billing alone since then has been $1.1 million. That's not counting medicine, that's not counting equipment, that's not counting anything else. Just St. Luke's billing alone for treating my conditions has been 1.1 million instead of.
Okay, I just want to repeat that for a second because I think that that's really important. So the original denial, as you just said, was for a $3,000 stent.
At the crux of the argument was that my doctor requested a stent. That stent cost $3,000. They turned it over and said no, that it wasn't medically necessary. I reached the point where during physical therapy, I could walk a pretty good amount of time on the treadmill, and I thought I was doing pretty good. So I wanted to take my daughter to the park, and I did. And she was playing at the park and running around with the other kids, and at some point, something upset her. I don't know what. She took off and darted towards the parking lot. And I got up and I tried to run, but I couldn't on my trainer leg. So I just yelled, and this other dad saw my daughter going between the cars as this white SUV was coming down the hill. It was that event that made me realize that the ability to run is not only medically necessary, it is a parent's protective capacity that they are denying amputees.
450 million claims get denied every year, and providers are spending over $20 billion a year to tackle this problem.
Yeah, and by the way, the process to appeal a denial is onerous and almost ridiculous. They almost make it so hard that you give up, you throw up your hands, you say, fine, what am I going to do? Either not get the procedure or I'll just pay it. And that's not the way this is supposed to work. The patients and the insurer, the people who are insured are not ATMs that only work one way, where the insurance company takes your premiums every single month and then suddenly when you need them, deny. So can you give me some hard numbers on your successes here in this process?
Profit and greed over beneficiary interest is something we will continue to investigate and prosecute aggressively. This office will continue to take decisive action to protect the right of Medicare beneficiaries and vulnerable Americans. The complaint says broker groups push their agents to sell plans from insurers paying kickbacks, even creating teams within their companies that only sold those plans. In some cases, they refused to offer plans from companies that didn't pay enough. The lawsuit started as a whistleblower case filed by an individual outside the federal government under the False Claims Act. The law lets people sue on behalf of the U.S. if they think fraud's involved, and if the government wins, they can receive a portion of the money. In this case, the Justice Department stepped in and took the case. If the companies lose, they could end up paying triple damages plus fines.
All right, picture this. Folks, grab a seat because I'm about to tell you a story that'll make your blood boil and your heart cheer all at the same time, all at once. It's the story of a son who watched his own parents get fleeced by a shady Medicare broker. And instead of just shaking his fists at the system, he rolled up his sleeves and built a company to fight back. This is a story of Kobe Blumenfeld Gantz and how Chapter Medicare came to be, a tale of family, betrayal, and a mission to save seniors from getting ripped off. So imagine Kobe, a sharp young guy watching his parents hit that Medicare age. They're good people, worked hard their whole lives, saved up for retirement, ready to enjoy their golden years. But then comes the Medicare maze, paperwork piling up, deadlines looming, and a slick talking broker promising to handle it all. Sounds like a lifeline, right? Wrong. This broker wasn't there to help. He was there to cash in. He pushed Kobe's parents into overpriced plans that didn't even fit their needs. Plans that cost them thousands more than they should have paid. And for what? So this guy could pocket a fat commission while Kobe's parents were left holding the bag, stressed out, confused, and out of pocket. Now, let me tell you folks, this wasn't just a bad day at the office. This was personal. Kobe saw his parents, his own flesh and blood, nearly miss critical enrollment deadlines, drowning in fine print and getting scammed by a system that's supposed to protect our seniors, not prey on them. It was a wake-up call. Kobe realized this wasn't just his parents' problem. This was happening to millions of Americans, good folks like you, and getting taken for a ride by an industry riddled with conflicts of interest and where too many brokers care more about their paycheck than your health care. But here's where the story gets even better. It gets real good. Kobe didn't just sit there fuming. He said, enough is enough. And in 2020, he co-founded Chapter Medicare with a fire in his belly and a promise to do better.
I think about it a little bit differently writ large. I think that every person at the company is creating culture every day, whether we mean to or not. It's just like it happens. Like we're a collection of humans. And so that's what a culture is. It's how humans act together.
He wasn't going to let another senior get conned like his parents did. Chapter isn't your run-of-the-mill Medicare broker, folks. Oh, no. They're like these superheroes of Medicare. They search every Medicare plan out there, over 24,000 of them across the whole country, to find the one that's right for you. And get this, they'll even recommend plans that pay them nothing if it's the best fit. And why is that? Because Kobe built this company on principle, not profit. And Chapter's advisors are there for you year round, not just when you sign up. And they'll hold your hand through enrollment, fight for your prior authorizations, even track down in-network doctors so you're not stuck with surprise bills. And the best part, it's free.
To me, the returns are pretty obvious. Like it comes in people making better decisions faster. It comes in being able to recruit a better team. It comes in, when you have good people, you can build better things, you can solve more problems.
It is entirely free, 100% free for you. And they get paid by the insurance companies. But unlike those shady brokers, their advisors aren't incentivized to push one plan over another. It's all about what's right for you. Kobe made sure of that because he never forgot how it felt to see his parents get taken advantage of.
I'm heavily involved, even when we're doing things like how do we set up different meetings and prioritization structures? How do we do quarterly planning? How do we do, how do I engage with the team, give feedback? Like it's the difference between massive failure and massive success.
And this isn't just a business, folks. It's a crusade. Kobe's out there calling out the industry's dirty tricks, even testifying before the Senate in 2023 to shine a light on deceptive marketing that's been fleecing our seniors for too long. And Chapter's growing fast, $75 million raised this year alone, valued at $1.5 billion because people are fed up with the old way of doing things. They want someone in their corner, someone who's got their back like Kobe had his parents. So the next time you or someone you love is wrestling with Medicare, think about Kobe's story. Think about a son who turned his family's nightmare into a mission to protect millions. And that's Chapter Medicare, folks. A company born from a scam that tried to break a family, but instead sparked a revolution. Spread the word.
But if you do think you need good people to build an amazing company, this is kind of the only way to do it.
So spread the word because every senior deserves a fighter like Kobe on their side.
You bet. Waystar serves over 1 million providers across all the different care settings. We're processing over 6 billion insurance transactions each and every year as we help providers and bring fairness, and we advocate for providers and patients as they interact with insurance companies. In January of this year, we launched a first of its kind generative AI solution called Altitude AI. It's a comprehensive suite of Gen AI capabilities that sit on the Waystar software platform to prevent denials and then to help providers rapidly follow up and appeal those denials. Let me give you a couple stats. On the denial prevention side, we're in a work that takes sometimes 3 days to successfully submit a claim. We're compressing that to 3 minutes using generative AI on the Waystar software platform. So we're reducing manual work. We're improving connection rates and first pass claim acceptance rates to the payers. And then in the event that a claim does get denied, well, Waystar goes right to work for providers and for patients. In using Gen AI again, in that use case, we're compressing the time it takes for a provider using Waystar Altitude AI by 70%. We're autonomously generating appeal letters, gathering appropriate clinical and administrative documentation on behalf of that patient, and then we're helping to submit that appeal letter on behalf of the provider, and we're seeing remarkably successful overturn rates to help appeal those denied claims. So we're getting started, and we're excited about our mission to help providers operate efficiently and spend more time focused on patient care.
Today, Taiwan Semiconductor is announcing that they will be investing at least $100 billion in new capital in the United States over the next short period of time to build state-of-the-art semiconductor manufacturing facilities. I think mostly it's going to be in Arizona, which is what I understand, which is a great state. I like it because I won it, but I won most of them, actually. But we won it, and we won it big. The most powerful AI chips in the world will be made right here in America, and it'll be a big percentage of the chips made by his company. But as you know, they're based mostly in Taiwan, and they're far and away the biggest. There's nobody even close. This $100 billion in new investment will go into building 5 cutting-edge fabrication facilities in the great state that we just discussed, Arizona, and will create thousands of jobs, many thousands of jobs, and they're high-paying jobs. In total, today's announcement brings Taiwan Semiconductor investments to about $165 billion. They've started already.
How about that? Matthew, good work. Congratulations to the company. And as we continue to watch the stock, we'd like you to come back, because I am sure the insurers aren't too thrilled about these overturned claims, but we think it's important because the number one reason for personal bankruptcy in this country is medical debt. And that is not a good thing. That is not a good thing. Thank you so much for joining us.
Waystar is here to help. Thank you. Nice to visit with you.
And it says, so what types of costs does Medicare exclude in 2025? And here's what seniors, retirees, and soon-to-be Medicare recipients should know about the potential coverage gaps they could face this year. What costs does Medicare not cover in 2025? While Medicare covers a wide range of medical services, these important categories fall outside its reach in 2025. First on the list is dental care, and one of the biggest Medicare blind spots is dental coverage. Medicare Parts A and B generally do not cover routine dental exams, cleanings, fillings, crowns, bridges, or dentures. So you're on your own for most dental work unless it's medically necessary because of another covered procedure, like dental work needed as part of a jaw surgery, for example, with the average cost of a dental crown running between $800 to $2,500 and dental plans costing several $1,000s per tooth. Skipping dental insurance during your senior years can mean big out-of-pocket bills. Next is vision care, and routine vision exams, eyeglasses, and contact lenses are also excluded under traditional Medicare. While Medicare may cover eye issues related to a medical condition like cataract surgery or diabetic eye exams, you are responsible for routine vision checks and corrective lenses. And this might not sound like a big deal until you realize that prescription glasses can cost hundreds of dollars a pair, and many people need updated prescriptions every year or two. Hearing aids are on the list, and hearing loss becomes more common as we age, but Medicare doesn't cover hearing exams for hearing aids, nor does it cover the devices themselves, considering that the average price of hearing aids ranges from $2,000 to $7,000 per pair. That's a serious expense most retirees have to pay out of pocket. That said, some Medicare Advantage Part C plans may offer limited hearing aid benefits. However, traditional Medicare does not. Overseas medical care. Planning an international trip in retirement? Medicare won't help you there either. Except for a few narrow circumstances, Medicare does not cover medical services you receive outside the U.S. That's why many retirees purchase travel medical insurance or supplemental Medigap plans with foreign emergency coverage for peace of mind when traveling abroad. Long-term custodial care, perhaps the most financially devastating gap, though, is long-term custodial care. Medicare covers short-term skilled nursing or rehab stays after a hospitalization, but it does not pay for long-term care if you need help with activities of daily living like bathing, dressing, or eating due to aging, dementia, or disability. That, in turn, can put you in a precarious financial position if you need longer-term care but don't have another type of coverage for it. According to Genworth's latest cost care survey, the average cost of a private room in a nursing home exceeds $120,000 per year in 2025, and assisted living and in-home care can also come with very hefty monthly bills. For example, the average cost of a home health aide is nearly $7,000 per month right now, while other in-home care assistance like homemaker services are only marginally more affordable. And why Medicare recipients should consider supplemental coverage now leads us to CBS News sharing, because Medicare leaves so many gaps, seniors are increasingly turning to Medicare supplemental insurance, also known as Medigap, to shore up their healthcare protection. Medigap plans help pay for many of the costs Medicare doesn't fully cover, including co-payments, co-insurance, and deductibles. And so why is now the right time to purchase Medicare supplemental coverage is the question presented. Here are a couple of big reasons. Healthcare costs keep rising. The cost of healthcare is already high and is continuing to increase across the board, but even small annual hikes can add up over time and can have an outsized impact on those with limited income. By purchasing a Medigap policy now, though, you can lock in coverage that helps soften the blow of these rising expenses, potentially saving you a lot of money in the long run. Your eligibility depends on your health. You have a 6-month window when you first enroll in Medicare Part B, where you can buy any Medigap policy without medical underwriting. After that period, insurance companies can deny you coverage or charge you more based on your health. And that's why it's smart to act early while you're still within your open enrollment window or in relatively good health to secure a policy. Medigap plans can also provide extra peace of mind when traveling abroad, as some include limited foreign emergency medical coverage, a feature not available through basic Medicare. The bottom line, Medicare is an incredibly valuable program, but it has its limitations. In 2025, there are still many healthcare costs that Medicare won't cover, from dental work and vision needs to hearing aids, overseas medical care, and perhaps most significantly, long-term custodial care. But the good news is that you don't have to face these gaps unprepared. By educating yourself now, considering supplemental insurance like Medigap or Medicare Advantage, and proactively planning for uncovered expenses, you can set yourself up for greater financial security later in life. And I do have a few more comments that I want to share with you guys. This first one here says, I am disabled and have been on Medicare for 10 plus years. It can be confusing. Unitedhealth told my dentist that all my products were going to be covered 3 times. The girl called in 3 times. Unitedhealth said, oh yeah, she's covered. Well, they didn't cover it. And I ended up paying $300 to have a tooth pulled. And with everything that's going on, I would make sure that I spoke to an expert, a Medicare expert, about my plan, my coverage, and my money. Kevin, thank you for telling the truth. My husband and I appreciate you. We called Chapter and my husband got better coverage and will, of course, save money. Thank you and Michelle very much. And thank you, Kevin. I saved $2 signs with Chapter. I hope this has been very helpful, beneficial, informative, provided value, and that you give Chapter a call for your free Medicare help, free Medicare consultation, and you come back and let us all know how it went. Share your story, share your experience, share how much money you are now able to save, if possible, based on your plan and your benefits. Their number is on the screen, 270-467-2426. There's additional information in the description, down below in the pinned comment. You can visit them at askchapter.org/Kevin, Kevin, or simply and easily pick up the phone and dial 270-467-2426 and tell them Kevin sent you.